For this year's ACP poster competition, we present a rare case of multisystemic sarcoidosis, which presented with unique clinical manifestations. Sarcoidosis is a rare chronic systemic inflammatory disorder which is characterized by the formation of non-caseating granulomas. It has a highly variable clinical presentation and disease course, as it can affect any organ system. It is named the Great Pretender due to its ability to mimic other diseases. Diagnosing sarcoidosis is not a straightforward process. It is important that compatible clinical features are associated with histopathological findings of non-caseating granulomas in the affected organs and that other disorders are excluded. 56-year-old female presented to our facility with acute encephalopathy in the setting of chronic history of diffuse lymphadenopathy. A few months ago, she was incidentally found to have asymptomatic mediastinal lymphadenopathy, for which she underwent an endobronchial ultrasound transbronchial biopsy, which did not yield a diagnosis. Upon admission to the hospital, her physical exam was remarkable for being nonverbal, minimally responsive to verbal command, and erythema around her cosmetically tattooed eyebrows. Her labs were unremarkable. Imaging was significant for moderate white matter hyperintense signaling on brain MRI, as well as extensive lymphadenopathy with several lesions invading the liver and spleen on CT scan of the abdomen. Extensive infectious workup, including CSF fluid analysis, was negative for an infectious etiology and showed a normal glucose and protein level. We then proceeded with a biopsy of the hepatic lesions, which showed multifocal non-caseating epithelioid granulomas with multinucleated giant cells. Based on the clinical picture, together with the biopsy results, a diagnosis of multisystemic sarcoidosis was made. The erythema around cosmetically tattooed eyebrows is Kevener phenomena, which is associated with sarcoidosis. The patient was started on high-dose steroids with an improvement in mental status, as well as the erythema around her cosmetically tattooed eyebrows. Figure 1 shows bilateral eyebrow erythematous plaques with scaling on cosmetically tattooed eyebrows. Figure 2 shows axial MRI T2 flare showing confluent white matter hyperintense signaling. Figure 3 shows innumerable hypodense lesions invading the liver and spleen parenchyma on CT scan of the abdomen and pelvis, and Figure 4 is a liver biopsy showing non-caseating granuloma, which is composed of aggregates of epithelioid, histiocytic, and multinucleated giant cells surrounded by a rim of lymphocytes without necrosis. At the periphery of the granulomas, benign liver parenchyma is seen. Sarcoidosis is a systemic disease that can involve any organ system. It is diagnosed by correlating clinical findings, histological findings of granulomatous inflammation, and excluding other infections or malignancy. In this case, what made us suspect sarcoidosis was multi-organ involvement, from the development of erythema around cosmetic tattoos to widespread lymphadenopathy and findings on the MRI brain, and finally the histological findings on liver biopsy confirmed the diagnosis of systemic sarcoidosis. Cutaneous reaction at the site of tattooing is a well-described phenomena called Kevener phenomena. This is an isomorphic response to skin trauma and can present as an early clue to systemic sarcoidosis. About 20 to 35% of patients with systemic sarcoidosis develop cutaneous manifestations. In many cases, this might be the only sign of the disease. It can follow after surgery, trauma, injections, or tattoos. Awareness of this phenomena by health professionals is important, as it can aid in early diagnosis and prompt treatment. Glucocorticoids remain the first-line therapy of choice for the treatment of the several sarcoidosis manifestations. In the refractory disease, immunosuppressants can be added. However, there are no guidelines that currently exist. This concludes the poster presentation. Thank you.